Gives me great pleasure to introduce Dr. Mike Bauerschmidt, who has attended the last two symposia in 2009 and 10, and he also attended here for a week in 2006. So we're very pleased to have Dr. Mike Bauerschmidt from Fort Lauderdale.
Thank you. Am I on? I don't seem to be. There, oh, there we go. Okay, good. Hi, I'm really pleased to be here. When Dr. Ron asked me to speak, I was kind of taken aback because, you know, I have no academic credentials at all. I'm not involved in any kind of research. I'm not affiliated with any medical school. I haven't even written a paper. Well, I take that back. I did write one article for Physician Executive on a coaching matter. But what I am is I like to think of myself as just a simple country doctor. And I know Fort Lauderdale and simple country don't exactly go hand in hand. But actually by that I mean I like to take what I learned in medical school, add a little common sense, and do what's right for the patient. Also, I am strictly the sole representative of my opinions and views here. This is based on personal experience and what little research I've done in preparation for this. What I also am is a certified life coach through Physicians Coaching Institute and with training at Coaches Training Institute, which is probably why Dr. Ron asked me to do this talk. How many of you, on a routine basis, talk to your patients about their emotional state? Great. By the end of this talk, I'm going to hopefully convince those of you that don't that you need to, and those of you that are, to give you the reasons why you are, give you further motivation to continue to do so, and just a couple of simple tools that will make your life easier. If we go on to the proposition, excuse me, that cancer is indeed a non-healing wound, the question that begs to be answered is, what wounded us to begin with? And to me, our health, or the lack of our health, is the simple manifestation of our body doing the best it can with what little resources we've given it to deal with. In other words, cancer in, cancer out. C also stands for smelly stuff, but you know, we're being videoed and I don't think the other smelly stuff would show too good on HD. But then it takes us right back to the original question, well, what gave us the C to begin with? And as was mentioned, I was fortunate enough to be here at the first IVC conference and heard Dr. Levy talk about, you know, you're either a toxin or an antioxidant. And if you're an antioxidant, you can donate an electron, and if you're a toxin, you need an electron. I said, I've heard that somewhere before. Where was it? I went, oh yeah, medical school. And you know, that simple redox equation, and I got to thinking about, you know, this is really a very simple model that makes sense. So it automatically appealed to the country doctor in me. And so I took it a little further and said, really, our health is being manifested based on the amount of oxidative stress that we've been accumulating over the course of our lifetime. And this is where Dr. Ron's little analogy earlier this morning about the apple came true. And if you stop to think about how the redox equation works, you know, basically every time we generate a molecule of energy, every time we take the NADH and make it NAD and create ATP, we are creating another free radical. So that even under perfect temperature and pressure, which is the only other thing I remember from chemistry, we are slowly rusting, which is why we can't live forever. So even if we bathe ourselves with lemon juice and preserve our apple for a period of time, we still are going to slowly rust. So the question is, are we going to rust? No, the question is, how do we accelerate rusting? And so when I talk with my patients, I've kind of realized that there's basically four main areas that will increase the rate at which we rust. And I call it the DEEP approach. And D is for diet. You know, we just finished a great lunch here. Thank you, Riordan Clinic. You got great cooks. But if you notice, it was all nutrient-dense food. There was no processed foods hanging around there. Because as we process the foods, we take out the nutrients. Duh, nutrients are on the reduction side of the equation. So by taking those out, we automatically increase our oxidative stress. The next area is emotions, and that's what I'm going to spend the rest of this time talking about, so I'll skip over that one for now. The third is the environment, and these are the persistent organic pollutants that we've been exposed to over the course of our lifetime. We had over 800,000 chemicals that have been manufactured since the 1900s. Chemicals that have not been in existence for over 30 years are showing up in the cord blood of babies born to 20-year-old mothers. Figure that one out. And that's not to mention heavy metals, arsenic, lead, mercury, cadmium, and arsenic, lead, and cadmium all have a synergistic effect, so even at relatively low levels, they have a serious toxic effect, primarily in the mitochondria. And let's not forget the pesticides, the herbicides, the plasticizers, the PBAs, the volatile organic compounds, the paints, the thinners, the lacquers, the list goes on and on and on. And then finally, physical. You know, what's already broken? You know, low T, functional hypothyroidism. And, you know, what are we talking about? People with cancer. Yeah, I think something's broke. So when Ron originally called and says, you know, I want you to talk about emotions as a cause for cancer. And I went, well, gee, that fits with my model. And it's, you know, I've got a couple of patients that come right to mind on this one. And Andy, and of course the names have been changed to protect the HIPAA police from raiding the place, was a 26-year-old with recurrent testicular cancer. He had several emotional triggers. His parents were divorced when he was young. He had a very emotionally abusive father. And you know, when I say this guy had an ego that comes only with having had walked on the moon. He had bedwetting issues into his teenage years. He lived in constant fear of loss of affection. He came after he had flunked an initial trial with traditional chemotherapy. They wanted to do a high-dose IV vitamin C, and despite the fact he now had to live with his father, which was just for him was a horrendous thing, his father was footing the bill and reminded him of it on an almost daily basis. He never resolved the conflict with his father. The cancer recurred, and despite high-dose IV vitamin C and aggressive chemotherapy, he succumbed to his disease. As opposed to Sue, who was a 32-year-old mother and wife, came to me because she had prolonged and heavy menses. She says, my hormones aren't balanced. I says, okay, so what else is going on? Well, you know, this was a few years ago when the economy took a dump and they had bought their house and are upside down in their house. The husband had just lost his job. They had started a business together that wasn't doing well, and they quite literally lost their house and were about ready to be on the street with a teenage daughter and several dogs. She came to me and says, you know, it's gotten to the point I don't even want to have sex with my husband. And interestingly enough, when she came back, you know, she's a good end. She has a happy ending because she responded to IV vitamin C as well as radiation therapy. And everybody, when she went in for radiation therapy, everybody kept looking at her and says, are you sure you're getting radiation therapy? You're looking way too healthy. So stuff does work. But she came back and said, you know, I really didn't want to have sex with my husband. And I said, well, when didn't you? And I said, well, you know, whenever I had my period, I didn't want to have sex with my husband. And of course, she had the abnormal pap and had the stage 2 cervical cancer that, like I said, responded to treatment. But the difference was she talked with her husband, they worked things out, you know, they figured out what they needed to do and made plans for their future together as opposed to pulling apart. So it was really, it really was an emotional victory. Now, the last IVC conference, I was sitting back in the corner and I was talking to some physicians from Tampa, and they mentioned this guy by the name of Ricky Gerd Hamer, who was a German oncologist who had seen over 31,000 patients and treated 31,000 patients. He himself had an acute psychic trauma that he believed resulted in his developing testicular cancer. And he went back and he reviewed all his patient charts and he says, yeah, there's an association not only between cancer emotion as an emotional causation of cancer, but also specific type of emotional traumas with specific types of cancer. And then I went to say, well, I got to get this book. So I went to try to find the book out of publication. I go, that's odd. Not only was it out of publication, it had limited availability, which is code word for good luck finding it, even in used. Couldn't find it used, put out the feelers to my environmental medicine community, and they said, no, never heard of it, can't find it. Even more interesting, the book that was written several years later about Hamer's book was also out of print with limited availability. So I'm kind of going, something might be up here. So then I went to Professor Google, and sure enough, you Google Hamer's name, and he goes, oh, sorry, he's discredited. We pulled his license. Your theories are dangerous. They're unproven. We've got several deaths that are lined up here, people willing to testify that you killed their loved ones by your weird theories. So now I knew I was onto something. But I didn't want to be dissuaded, so I switched from Professor Google to PubMed and found these guys called the Quality of Life Research Center in Copenhagen, Denmark. And they are basically a holistic medicine think tank. And what they did is they looked at Hamer's laws and tried to figure out whether they were substantiated by contemporary holistic theory. And what they found was his first two laws. He basically had 5 laws. And the first 2 laws dealt with psychogenesis and salutogenesis. So psychogenesis was basically you had this acute psychic trauma that caused you a problem, and the salutogenesis, by fixing the psychic trauma, we're going to fix the cancer. And these guys said, yeah, we're totally holistic in theory, we're behind it so far. Then they looked at the next 3 and kind of went, whoops, you're stretching our credibility here. And based on contemporary and traditional holistic theory, your next 3 laws, which were dealing with how you solve the problem, had no basis in holistic theory. And they said, while it's interesting, and we actually believe, and it's likely to be true, that for a limited number of patients that this will work for them if they're particularly committed to the path, we can't really say, we can't get behind it without having some other objective research. Does this sound like anything like vitamin C 20 years ago? Further, though, they said, okay, Dr. Hamer is also kind of like this weird guy, and his presentation is very idiosyncratic and provocative, and he managed to alienate himself from the whole medical community. So now I'm sitting there going, okay, his book's out of print, nobody can find a copy of it. He's been discredited publicly, and he's eccentric. So he's obviously onto something. So I kept going, okay, let's dig a little deeper, see if we can't find something more about emotions and cancer. And sure enough, back in 1991, of course, most of the literature's in German, and all I got were the abstracts, because I don't read German, on stress, cancer, and immunity. And the source was Hanover Medical University. I mean, this isn't any fly-by-night, Journal of Alternative Medicine or anything else. Well, they were just focusing on emotions as a dispositional factor. And they said, well, yeah, as a dispositional factor in a multifactorial origin, yeah, there is some basis for emotion as causation and certainly as progression for cancer. And what they came up with, though, as they were looking at it, they said, the cardiologists had they had an easy game because they had the type A personality. And it's like type A personality, high risk for heart disease. Well, is there a type C personality, somebody that's at risk for developing cancer based on their personality traits? And what they came up with is folks that have pathological niceness. That's, they use other things like exaggerated social desirability, they avoided conflict, overcompliance and overpatience. The bottom line is, these are folks that may have had boundaries, but under social pressure, they kept retreating with their boundaries, back and back and back. They kept giving and giving and giving until basically they disappeared as a person. And what they found that based on this coping style, that when people were subjected to stress, that there seemed to be a weakening of the natural resistance to the carcinogenic influences. Now, they also went on to say that patients with a more favorable outcome, can you guess, had a higher fighting spirit, had greater potential for aggression, had lesser suppressive tendencies. In other words, they had boundaries and they were willing to stick by them. Then dug a little further into the psychosocial risk factors for cancer development. And this is from the Med Clinics in Munich in 2007. And it was a current, and what they did is this was basically a review article. And they took the prospective studies that were available and they looked at them and said, okay, can we establish causation between emotions and cancer? And they said, well, you know, really, looking at them, we can't. And here's why. You know, there are all kinds of errors in these studies. There are sample size errors, there are failure to adjust for confounders, there are lengths of follow-up problems, there are variations in the measurement of the cancers. And also, importantly, as they said, that there are specific personality traits that may be associated with lifestyle factors. So it really didn't make any, if you grew up in a household full of smokers, it didn't really make any difference whether you had a type C personality or not. If you were smoking, you're more likely to get cancer, is what they were saying. Now, they did so go on to say that, like the previous study, the psychological parameters may alter immune and endocrine function. Well, here we went from, yeah, this personality trait makes you more predisposed to cancer, to here's the mechanism by which it may be happening. Enter the CDC. Of all people that I didn't expect to hear from, it was these guys. And in Public Health Journal in 2010, they looked at adverse childhood experiences are associated with the risk of lung cancer, a prospective cohort study. What this does is they looked at over 17,000 adults between 1995 and 97 and followed up on them. And they clearly said, yeah, adverse childhood events may indeed be associated with increased lung cancer and premature death from lung cancer. That, and here's the good part, may only be partly explained by smoking. So take that, Germany. So I was really getting even more excited because now it doesn't make any difference. You know, we now have a clear association between emotions and cancer without some of the confounding factors. So digging a little deeper, Journal of Neuroimmune Pharmacology, 2006, Ohio State, my alma mater. That's why I had to put that one up there. I was particularly proud of the boys. They were looking at psychoneuroimmunology and the title of the article was Stress-Induced Immune Dysregulations, Implications for Wound Healing, Infectious Disease, and Cancer. Granted, these were mice studies. Okay? I mean, it's really hard to get people to sign up for this one. And what they were showing was that there is a very complex bidirectional communication between the central nervous system, the immune system, and the endocrine system. And that protracted stress interferes with this system of communication enough to do all these following things: reduce immune response to vaccines, slow wound healing, reactivate latent viruses, and enhance the risk for even more serious infectious diseases, as well as the risk for several conditions, including certain cancers. And how they were saying it was happening is because the chronic stress and or depression increases the peripheral production of cytokines, which were well covered earlier today. And we know the cytokine, increased inflammatory cytokines, is that's that poor wound healing. We got screwed up, as Dr. Ron so elegantly showed us, really screws up the normal healing process. So we're getting even a little closer. So now we've got, yes, there is a causation. Yes, here's the mechanism by which it can happen. And now here's the rest of the story, as Paul Harvey used to say. This is a review article from the Journal of Clinical Oncology, 2010. So the boys are coming around. And while they said, like the German articles and, before said, you know, the evidence for psychosocial factors for the cancer initiation is equivocal. And let's stop and think about that for a second. How can it not be equivocal? I mean, who's going to say, oh yes, let me sign up for the study that you're going to subject me to only psychic stress and see how often I get cancer? Well, what about heart disease? You know, if I don't die of a stroke or a heart attack first, yeah, I'm probably going to get cancer. Yeah, let me sign up for that study. Can I be in the placebo group, please? So what I was saying is that evidence is equivocal. The support continued for links between psychosocial factors and progression. And then they went on to show, here's the pathway by which it happens. And they take life events, social isolation, socioeconomic burden, and it puts the hand in the fire alarm in the brain. Fight or flight syndrome ensues. Well, what happens when fight or flight happens? Well, you increase your corticotropin-releasing hormones, you decrease your oxytocin, you decrease your dopamine. And these increases in cortisol actually act synergistically with all these catecholamines to increase cyclic AMP uptake into tumors. And this was based on a lung cancer model. So the stress is actually feeding the tumor faster than anything. Imagine that. But also, beyond just increasing energy into this tumor, it has a direct effect on the immune and the stromal cells in that it decreases natural killer cell function, it decreases T cell activity, increases regulatory T cell activity, and increases the tumor-associated macrophages, which is the matrix metalloproteinases, say that really quick 3 times, and inflammatory cytokines. There they are again. But further, in terms of the cancer cells themselves, they're finding an increase in the migration and invasion of the cells, as well as an increase in the angiogenesis. So not only is the tumor now, has a campfire now been turned into a bonfire, it is now doesn't have any boundaries. There's nothing to keep it from spreading like wildfire. So the bottom line is stress unfavorably influences cancer growth and progression, and can also significantly, therefore, alter the quality of life of your patients. So, does everybody need psychotherapy? Probably not. And they don't necessarily, although Dr. Hamer would disagree. He says, you know, if you don't deal with that psychic stress and get down to the bottom of that one, you have no chance of curing the cancer. But I think there's probably everybody in this room has had 1 or more people that have managed to survive despite years of intensive psychotherapy. But then, what is your role as a doctor? Well, you know, the Greeks, you know, doctor, and everybody knows about the doctor as a teacher. And you remember back in high school when your coach probably taught government class or American history? Well, coaching is really a very simple, it's just simply the art of listening. And what are you listening for? You're listening for the real message. You know, what's between the lines? What's really being said? And then you use that information about what the real problem is to help people realize what it is they really want. As an example, I'm afraid of chemotherapy. Well, what are you afraid? Well, I'm afraid I'm going to lose my hair and I'm going to be ugly and my husband's not going to love me anymore. Okay. Reasonable. And what is it you really want? Well, I really want to have a loving relationship with my husband and live forever. Okay, well, let's reframe that. Instead of acting out of fear, let's act out of the position of what it is you want. And, you know, some people in this room may, you know, the universal law of attraction is what's coming into play here. You may have heard of. So it's just using that information to help them reframe it. Because when you're acting out of fear, there's 2 definitions that I like to use for fear. One of them I can't really say on public television, so we'll just use the first F is freak everything and run. which is what we typically do when we're under stress. And that response is appropriate if you got a semi coming at you head on down a one-lane road, or if there's a fire in your house. It's not appropriate if you want to live a rich, full life when you're challenged. Which leaves us with the second definition of fear, is face everything and recover. And just helping people reframe that from that, like, you know, this is not something to be running away from. This is something to be faced and conquered. Can often just be a big difference in helping them take the hand off that fire alarm. And by helping them change their perspective, then they can achieve what it is they really want. So instead of fighting it, they're working for it. Or another way to look, instead of running away from something, they're running to something, which is what really a race should be all about. I want to talk to you for a minute about a program that I developed with with a cancer survivor who went through coaches training with me. And she, her big passion in life was to help other cancer survivors recreate their life. And we based the experiences that she had on, based the workshop based on her experiences as a cancer survivor. And then we presented the workshop to others as a way of helping them change their perspective. And so instead of running away from cancer, they were running to a new life. And the literature is replete now with, you know, the new you as cancer survivors. What we used is there's a paradigm that each of your cancer patients is going to go through. And of course, living in Florida, we use the kind of the tropical storm system as the paradigm. And say somebody finds the lump, or they're bleeding from someplace they shouldn't have, or they got this mold that's changing. That's kind of the tropical storm warning.
Hello, we have a new wave rolling off the west coast of Africa and is likely to impact the Florida coast sometime in the near future.
Okay, so we'll go buy our water, we'll go see the doctor, we'll, you know, see what's going on. Okay, the diagnosis comes back, you got cancer.
Hello, this is the Weather Service reporting, and the Hurricane Ida is headed your way. Get ready.
And that's really the time when people kind of sit back, they're knocked back on their heels, and they're doing the questions about why me, how did this happen, what's going on, what's going to be, you know, what kind of life am I going to have? Because they know the hurricane's coming their way, they have no idea what's going to be left after it hits. And in a traditional treatment, you're in the 9th ward during Hurricane Katrina. And you have got to suffer the brunt of the storm and the consequences thereof. And then when you're done with the treatment, the doctors all go, okay, you're good. Go rebuild, go have a fun life, go back to what you were doing. And you kind of go, excuse me, go back to what? Everything I had means nothing to me anymore. And that's what we dealt with the program, helping them find out what was important to them again. And in the course of doing this workshop, which lasted anywhere from a few hours to a couple of days, depending on our audience, we learned some very important lessons. And one of them is that there is a very specific dynamic that occurs between the patient and their caregiver. And I don't mean you as the doctor, I'm talking about the caregiver, the person that's going to be walking through this cancer experience with them. One's going to be taking them to chemotherapy and the radiation, or coming to your office, or whatever. The people that are going to, day in and day out, are with the patient. And this relationship are frequently, as in more often than not, victims of collateral damage. And the reason is, remember the type C personality. These people were always in the position of giving, giving, giving. It's that they don't know how to receive. They don't know how to ask for anything. It's always about somebody else. And here you have somebody now, you know, they're impotent. I mean, chemotherapy, radiation is going to knock you right on your butt. You're not going to be able to get up and do the things you used to do. And you don't know how to ask for help. But you want to maintain your independence because you got to go out there and save the world. And then you got the caretakers who are sitting there going, oh dear, please let me help you. Isn't there something I can do? Please let me do that for you. And so just a 3-minute conversation that says, okay, you got cancer, you want to maintain your independence, you want to be active, you want to do for yourself, and there's going to come a point when you really not going to be able to. You need, at that point, to accept the responsibility, or take the responsibility to accept the help from your caretaker. You, caretaker, rein it in. If they say no, they don't want help, respect that. There'll be plenty of time for you to help them, believe me. That's as long as it takes. And it make a lot of difference in the outcome of that marriage or that relationship. And of course, the survivors, like the original study, had the willingness and belief in their ability to live. Really important study. If you got a patient coming in like, this is going to kill me, probably right. Probably right. Everybody's, I did 25 years in the ER before I came out here and learned from Dr. Ron about how to do a functional medicine, and just didn't care. I just stole the idea and said, I can make this work in Fort Lauderdale. And sure enough, I have. But anyway, 25 years in the ER, I remember the guy came in, simple gunshot wound to the epigastrium, you know, no pneumothorax, no hemothorax, breathing, vital signs all stable, all wonderful. He's there going, I'm going to die, I'm going to die. He says, no, you're not, you're fine. The surgeon's on the way and take you up to the OR, patch up what's wrong. Going to be fine. No, I'm going to die, I'm going to die. And sure enough, he did, because that bullet went through the stomach, nicked the aorta, and created a gastroaortic fistula. And once his stomach filled up with enough blood under pressure, when he started vomiting blood, he didn't stop. And sure enough, he was dead. So patients come in and say, this is going to kill me. If you cannot dissuade them from that fact, you may as well get the sympathy card ready. So as a result of the program, though, it was magnificent. People can heal themselves. There was a fourfold improvement in knowledge of their personal values. If people can reconnect with their values, they can repurpose their lives. Because they'll typically come in saying, I don't know what to do anymore. You know, the stuff that used to be important to me, I used to love going to work. I can't stand the idea of doing that you know, 12-hour day work anymore. You know, I want to do something different. Well, what's important to you? Well, I don't know. But if they know what is of value to them, then they can begin to develop a new purpose for their life. Like I did, I had a car accident, couldn't work in the ER anymore. That was my life. It was my career. I loved going to the work in the ER, saving lives, snatching people from the jaws of death. That was wonderful stuff. Had the car accident, couldn't do it anymore. And I sat in the chair and I kind of went, what do I do? I couldn't imagine opening up a primary care practice and doing the insurance mill thing. That was just like, I'd rather go to law school. So my wife had the good sense of sending me to it. Says, here's the name of 3 life coaches, pick one. And helped me repurpose my life. And then with visiting out here, I kind of went, I can do this, because I always loved taking care of patients. So connecting them with their personal values and it's not hard to do. 5-fold improvements in feelings of control and empowerment. Remember, these folks were out of control. Their type C personality was they had no control, they had no power, they didn't know how to make a boundary. They're getting run over on a daily basis, emotionally and mentally. And an increase of knowledge of what stops change. This is the saboteur. That's that little voice in your head says, no, you can't, you won't, you're not sufficient, you know, what makes you think you're that good? There's ways of getting rid of that too. And then the 6-fold increase I was really proud of is the ability to take action. Yeah, now I've got the tools, I can go out there and kick some butt. So what can you do in the office? It's really simple. You learn to listen. And so, well, I listen all the time. Yeah, but at what level do you listen? There's 4 different levels. Level 1 is what we typically learned in medical school. Okay, I'm going to walk in the room, I've got 10 minutes, I've got to ask them very pointed questions, get very direct answers, and, oh, by the way, I got to be thinking of, oh God, I got that meeting at noon, and then the wife was kind of grouchy today, I got to remember to order some flowers, and then Mrs. Jones is coming in at 3 o'clock, and you're only half listening to what's going on with the patient. We're all very good at that. We need to stop. Level 2 is kind of level 1 turned inside out, where this is the 2 lovers on the park bench and they're looking at each other's eyes and all they see is each other and they're totally oblivious to the fact that there's CPR going on over here, there's a mugging going on over here, there's a wildfire over here, and oh, by the way, the zombie apocalypse is coming up on my rear. Have no clue of anything else other than what's right there. Level 3 is you're finally rejoining the human race. Here the therapists are really good. The therapists start communicating with you when you walk in the room. And they watch how you walk in. You know, is your head down? Is your head up? Are your eyes open, kind of taking in the surroundings? Are they kind of downcast and forlorn? When you sit down, are you sitting all crossed up and like nobody's getting in? Or are you saying, hey, I'm here to learn? Level 3 also implies that not only are you listening with your eyes, but you're listening with your ears as well, and you're also picking up on not only what they're saying, but how they're saying it, and how the person in the room with them, because generally your cancer patients are coming in with the guy that's taking notes, at least they are in my office, the guy that's taking notes, and picking up on how they're responding as well. And that's really your most effective listening on a day-to-day basis. Level 4 comes in with a little bit of practice, and you'll do this in no time at all. And not only will you not only will you get the idea of what's being said and how it's being said, but you're also going to be able to begin to read the energy in the room. And this is where, you know, is there an overwhelming sense of anxiety? And you'll learn what anxiety feels like. And you'll be able to pick that up in their voice first, and then you kind of like, oh, yeah, this is kind of what anxiety feels like, or fear, or pure joy when you finally get to give somebody some good news, like, hey, your tumor markers are down. And you'll pick up on that. And actually, level 4 is more fun for you as a practitioner because you get to experience the conversation as well as have it. What else can you do? In front of you, you have a sheet of paper that looks like this. And this is something I have everybody fill out in the office when they first come in and then on yearly follow-ups. You all have pens there. What I want you to do, this is a self-rating scale. And a rating scale goes from 0 to 10. 0 is there in the center at core values purpose, and 10 is the outer ring. What I want you to do is rate yourself with terms of your degree of satisfaction, not what it should be, not what you'd like it to be, but where you're at right now in terms of your degree of satisfaction with these 8 different areas of your life. And when you mark it, just mark it so that you're making a little, you're just kind of filling in the line that corresponds with where you're at. So go ahead and take a minute and do that. Won't take you long. This way you'll know how long it takes your patients to do it. Looks like people are pretty much done. Okay, how many of your wheels, when they're done, look like this? Raise your hand. Like, whoop, like that right there on the board, where it's a perfect 10 all the way around in a perfect circle. How many have perfect 10s all the way around? Okay, congratulations. you are out of 1,400 of these I've done in the last 3 years, I've had 2 that had perfect 10s. And they had absolutely no financial, they sold companies for multi-millions of dollars, they had a great relationship, they were able to follow their passion and do everything they want out of life, they live where they want and do what they want. They said, life just doesn't get any better than this. I said, good, we don't have to worry about that part of your deep protocol. Most often I get things that look like this, or this. And you say, okay, well, what do I do with that? Well, it's real simple. Just ask them what they see. They just did it. What did you guys notice when you did this wheel? Any volunteers? Just when you did it, did you have any insight? Sometimes and this is pretty typical, about 10% of the time people kind of go, oh my God, am I screwed up? It's like, I got some work to do here, Doc. I said, yeah, you think? But the rest of the time, when they kind of give me that funny stare back, I kind of go, okay, connect all the lines like this and make it look like a wheel, a true wheel. Put that wheel on your car and tell me how far down the road you're going to get. And I kind of go, oh, yeah. Then I tell them, the more out of balance your wheel is, the more your hand is on the fire alarm in your brain. And we all know what happens when you put the hand on the fire alarm in the brain. You raise your corticotropin-releasing hormones, you decrease your dopamine, you decrease your serotonin, you feel bad, you look bad, and you're destroying your immune system. Any downside to that? So what do you do for them? You say, okay, Di, it's nice, now I know I'm screwed up, what are you going to do about it? And it's really simple. If you just ask them, how often in the course of a day do you find yourself saying, I have to, I need to, or I ought to? And if you're 90% of the women in my practice, they kind of go, oh, how many minutes in a day are there? I kind of go, okay, what I'd like you to do is I want you to substitute I choose to or I want to. Whenever you say I have to, I need to, or I ought to, I want you to catch yourself and say I choose to or want to. And then sit with the feeling. And I said, and right now, anybody that does this, think of a time during your day when you say I have to, I need to, or I ought to. Got one? Now substitute I choose to or I want to. And think about that same activity. Isn't it just kind of like, oh, yeah, that's I'm a choice. I'm no longer a petulant child being pushed through the door on the way to the bus stop to go to a school I hate. I'm an adult with a free will that is engaging in activity I choose to do. And that in and of itself takes the hand off the fire alarm. Now, there's going to come a time when you kind of says, well, yeah, I choose to, and they kind of go, not really. And this is when you offer them the opportunity to set a boundary. It doesn't mean they're never going to do that particular activity. It just means they're not going to do it right now. They're going to cut themselves a little slack. Being nice to yourself is one of the hardest things people have to do. It's taken me a long time to learn how to be nice to myself. How many of us, and we're all professionals. We all made it through medical school. We're all hard driving, hard charging, name takers, heartbreakers, and it's really hard for us to kind of go, hey, you're a pretty nice guy. I like you. It's a tough thing to do, but this is a way that you can help them on that path. So learning how to set boundaries is a really important thing for your patients, particularly your cancer patients. If that doesn't work, you can always resort to the codependency triangle, and you'll be able to pick these folks out in a heartbeat, because they're going to come in and they're going to bounce around this triangle like there ain't no tomorrow. And they'll be the victim, they'll be the persecutor, they'll be the rescuer, all within 5 minutes. It's like, I can't believe this has happened to me. All this bad stuff always occurs to me. It's just, I can't walk outside and there's going to be a bird that's like pooping on my head. It's just that nothing is working right. And on top of that, I always have to go over to my son's house because he can't learn how to have a good relationship with his wife, and I got to take care of the kids. And it's really beginning to piss me off. Anything wrong with that picture? And just pointing this out to them and saying, did you see how you just played this game with yourself? And they kind of go, oh, yeah. And just that simple awareness can be transformational for them because it gives them a way off the board. They're no longer playing the game because the only way you can avoid getting into this game is by not getting into this game, and you do that by setting boundaries. Now, if you guys say, you know, I really don't have time to take this, which actually only takes as long as it's taken me to show it to you guys. All it takes. If you don't like that, there's a book called Crucial Conversations by Joseph Grenny. Highly recommended reading. I think Tiffany arranged to have some books. I think they may be upstairs. She was going to arrange to have some of these books brought in. Crucial Conversations was actually written for executives, and it was how to talk when the emotional stakes are high. But it's applicable for anyone that needs to take the emotions out of a conversation. How many of you have had this experience? Oh, the lights. This is a good one. Someone in your family is leaving the lights on whenever they leave the room. Now, if you were like raised in my house, it was, when not in use, turn off the juice. So having a light on in a room nobody was in just like hit some very important nerve fiber bundle deep in my brain, and I just want to respond with, can anyone learn how to turn off the freaking lights in this place? What am I, made of money? All the things that my father said. Which irritates me because I'm reminded that I've turned into my father. But more importantly, what I've learned is that is not the time to bring it up to the person who left the lights on. Because not only am I emotionally invested, I'm going to attack them with my words, and they're going to get defensive. Now, both our fire alarms are going off. This has no good ending, and I am not a thief. So this book is really very helpful in helping people realize how to have these kind of important conversations. And it's absolutely imperative for your type C personalities. Now, I'm not going to stay here and tell you that every cancer patient has a type C personality, nor am I going to say that if you don't have a type C personality, you can't get cancer. We all know there's logical fallacies to both those positions. However, whenever you see this happening, here's a really good opportunity to make Joseph Grenny some money and help your patients. And actually make your life easier too. What else can you do? Choice theory, William Glasser, another great book. It's not about what has gone on. It's not, gee, your mother painted your room green when you wanted it yellow when you were 4 years old. Get over it already. What do you want for your life from this point forward? Yeah, you've been dealt a raw hand. Yeah, this has been a bum rap. What are you going to do about it from now on? We can't, the one thing you can give up is all hope of having a better past. What kind of future do you want? And that's what choice theory is basically all about. It is about where do you go from here. And the basic tenet for this book is if you don't like how you feel, you got to change what you think or what you do. And there's this very good logic to this. I mean, how many of you have been able to be angry and smile at the same time? And I'm assuming there's no trial lawyers in here. You can't. And that's basically what he's doing. And he develops the whole theme about how to do it and why it's important to do it. Finally, there's the, and if you can only do one thing, you don't want to do any of the rest of this stuff. You don't want, your patients can't read or they can't read English or whatever. There's nothing else you can do. There is a What's Next for My Life workbook that the person that I developed the coaching program with, I went on to do my functional medicine practice. She went on to do cancer survivor coaching, and she developed this workbook on her own. And it's basically a self-assist book, and it'll help your patients coach their way through the cancer experience. It's available I didn't get the order form because it was, and I forgot, I did not bring a copy of it with me because it was basically back at the printer. She had sold out her initial run. But if you're interested in it, you can contact me directly or contact me and I'll order them for you, or I'll give you Paula's number and you can order them directly through her. They're like 15, 16 bucks. And if somebody's going to spend $3,000, $4,000 on IV therapy with you, give them 15 or 16 bucks. It'll make them feel good and make your life easier. So, in summary, cancer is indeed, in my opinion, a non-healing wound. And it's oxidative stress that's the culprit. And emotional stress, as one of the 4 major stressors in terms of increasing your oxidative stress, along with diet, environmental toxins, and physical, is a significant factor for cause as well as progression, and that Hamer was not all wrong. I can't say here that, yeah, he's absolutely right, and if we just reverse the psychic trauma, we're going to reverse the cancer, but there's too much other evidence out there that says bad emotions will influence your outcomes. So, you can improve patient outcomes with simple methods, not requiring years of psychotherapy. Went through them here this afternoon. If you want to talk about them more, I'll be happy to discuss it with you after the conference, or call me back when I get back home or whatever. Happy to run through it with you. But what you cannot do, I hope, is from this day forward, ignore the emotional component of cancer therapy. Any questions? Thank you for your kind attention.
Since there are no questions from the audience, I will ask a question about how are you combining your functional medicine with this? I think it'd be great.
How am I combining?
Are you working with functional? You said you went on to functional medicine?
Functional medicine, yes. And how am I?
Just how do you, your typical approach?
Typical approach is I basically, along Dr. Riordan's model, Dr. Ron as manifested to me, Dr. Ron, is basically when I schedule, I don't take insurance. You can't do and take the time that you want to take with the patients and take insurance. It's just economically, you can't do it. So my patients come in knowing they're paying out of pocket. They do get a super bill. And if they have out-of-network benefits, they will get reimbursed for the professional component of the visit. I spend an hour and a half with the patients the first time and basically, do the standard history and physical, but then I also run through the deep approach. And based on the history and physical, I try to get a feel for, what's most important. Is diet the big issue right now, or is the emotional component the big issue, environmental toxicity? Really a couple really simple questions for environmental toxicity. Just ask them, do smells bother them? And if they say, oh yeah, I can't walk down the soap aisle at Publix or Kroger's or whatever you have in Kansas. So it's okay. Yeah, I can't walk down the soap aisle because I get a headache or I get nauseated. Their total body burden of toxins is overwhelming. And you need to seriously look at that as the first stage for their therapy. And then finally physical, gee, my hair is falling out, the typical hair is falling out, I'm gaining weight, I'm tired, and the doctor says my labs are all normal. Please. And that's basically what I do. And so, and the balance wheel just comes into the emotional component. And it really takes 7 to 10 minutes out of that 90-minute visit because they come in with this completed already, and I kind of go, okay, tell me what you see. And they kind of go, oops. I say, yeah, busted. This is what you can do about it. And just go through the have to, need to, ought to. And most times when they come back for their follow-up to go over their labs as I run them, they kind of go, yeah, that stuff really works, doc. It's like, yeah, I'm getting along better. I'm not feeling pressured. I'm sleeping better. It's a simple fix, folks. It's easy. And it doesn't, and no special training. Yeah, I went through coaches training, but that's not, this is about the training I had on the balance wheel is what you got from me. So go do it.
Thank you very much.
Sure.